Big area, we're really going to be focusing on cancer. Cancer is something that affects 60,000 people in the United States. And this is something that we need to focus on to really look at all of the different conditions and factors that can contribute to the incidence of cancer that are often overlooked or not discussed in conventional medicine. At our naturopathic practice, our mission is to identify and heal the causes of an individual's condition by combining highly advanced science and cutting-edge diagnostics with natural remedies, both modern and ancient. Many patients come to us from the regular practices because they're tired of the shortened visits and the prescription drugs with their side effects. As a naturopathic doctor, we're called NDs. I can write prescriptions for drugs, but I typically write them for high quality supplements, herbs, and healing food. I also incorporate Chinese medicine because it's the perfect partner for Western herbs and other natural remedies. Beyond what I do, my passion is to educate and empower as many people as I possibly can with their health through events like this, both online and off. My own specialty is the medical treatment of autism, ADHD, and other special needs. Our other two doctors specialize in women's health, autoimmune diseases, weight loss, gut health, and other complex conditions, including cancer. We don't take new patients without a no-charge phone consultation to make sure that there's a good fit. Contact information is on our Facebook page, so please feel free to reach out to us to schedule so that you can have a chance to talk with me and get your health concerns addressed. We are talking today about reducing cancer risk. So let's begin by reviewing a few facts about what cancer actually is. What is cancer? All of the cells in our body have a lifespan. They are supposed to exist for a certain amount of time and then die and be replaced by new cells. Some cells live for 2 days and other cells live for several years. With cancer, the cells become mutated, meaning that they undergo a change in their structure. The part that is supposed to tell the cells to die gets turned off, and they keep living and growing. When cells get mutated, they often stop performing their normal jobs. So, for example, white blood cells are supposed to fight off infections, but with leukemia is a cancer of the white blood cells. You have all of these white blood cells that keep multiplying and don't die, but they're not fighting infections anymore. They just take up space. And as they continue to grow, they can eventually form into tumors. Currently, 40% of Americans will be diagnosed with cancer in their lifetime. That's 132 million individuals, moms, dads, siblings, children, relatives. Each year, close to 2 million people are diagnosed with cancer and over 600,000 die from it. In fact, most of us know someone, perhaps in our own family, who has had cancer. 4 of the most common cancers are breast, lung, colon, and prostate cancer. There are generally accepted guidelines for cancer prevention. The general guidelines include eating anti-cancer foods, getting sufficient exercise, having good quality sleep, and managing stress. Lots of the fruits and vegetables, especially vegetables, are high in antioxidants, carotenoids, and polyphenols. I know these are big words, but these are essentially compounds that are found in foods that have tumor-fighting properties. For example, apples are high in polyphenols, berries are high in antioxidants, carrots are high in carotenoids. There is also a compound called sulforaphane that decreases the growth of cancer cells that is found in cruciferous vegetables like broccoli, cauliflower, kale, and so on. One of the best sources is broccoli sprouts, which have much higher levels of sulforaphane than regular adult broccoli or other kinds of sprouts. Sulforaphane also helps to increase glutathione levels. Glutathione is one of the main antioxidants in our body. It helps to decrease inflammation and binds with toxins so that they can be removed through our waste. Cancer risk is also increased with higher levels of both inflammation and toxicity. Fatty fish like salmon, mackerel, and anchovies can help to reduce the risk of colon and prostate cancer. The American Institute for Cancer Research has found that all nuts have cancer-preventing properties. Walnuts in particular were found to be helpful in reducing the risk of breast cancer. Legumes such as beans, peas, lentils, and so on help to reduce the risk of both colon and breast cancer. Another general risk factor for cancer is vitamin D deficiency. Vitamin D comes naturally from the sun, so that's one of the main sources that we get it from. That being said, you do need to watch and balance that risk with skin cancer risk when there's UV light exposure. So that's something that should be addressed with your physician individually, looking at your individual risk factors. However, I do often recommend that many people take vitamin D as a supplement because most patients that I test for vitamin D are far below the optimal levels of vitamin D that they need to help with reducing cancer risk. Also, let's remember the importance of exercise. There are 13 different types of cancer whose risk is lessened because of regular exercise. These include breast, colon, prostate, lung, uterine cancer, and more. Also, if people have cancer already, exercise assists in recovery and increases the likelihood of survival. It can also play an important part in improving overall physical and mental well-being. In addition, exercise very likely makes anti-cancer treatments more effective in destroying cancer cells. It can also improve sleep. In a moment, I'll be explaining 3 other medical conditions that can be underlying some of the things that can be contributing to cancer risk. But first, I find that people do call and talk with me after viewing a video or two and visiting our website, and some do become patients. You're welcome to schedule a no-charge phone consultation with me. Our phone number and other contact information is on our Facebook page. I also encourage you to visit the online supplement store that I founded as a fundraiser for special needs children. All of the vitamins, herbs, and supplements are tested for purity by independent labs. And there is a 20% discount. Additionally, our store is the only one where proceeds go towards helping special needs families with the cost of their child's treatment. The store is on our website at drtaketa-wong.com. That's Dr. Taketa-Wong, one word. Now, let's get back to focusing on cancer prevention. There are 4 types of cancer that I'm going to be discussing today, and we're also going to be talking about some of the keys in each of these with helping to reduce that cancer risk. With breast cancer, birth control pills and hormone replacement therapies that contain estrogens can be associated with a higher risk. The only birth control pill that does not have estrogen is called the mini pill. Research shows that a woman's risk for breast cancer increases with the amount of alcohol that she drinks. Risk is also elevated if she doesn't have enough exercise or movement, and being overweight increases breast cancer risk as well. So in these factors, being overweight as well as alcohol also play a risk factor in other types of cancers as well. For colon cancer, there has been an alarming increase in colon cancer among people in their 20s and 30s, whereas it used to only occur in people in their 50s or older. Why is that? The big big risk factor is the food that people are eating. A diet that is high in fat and low in fiber, as well as one that is high in processed meats that contain nitrates or nitrites, elevates one's risk. Processed meats include hot dogs, Spam, sausages, including Portuguese sausage, bacon, and as I mentioned, in Hawaii, we love our Spam, so that is a risk factor. Cold cuts such as bologna, ham, turkey, chicken, these so-called deli meats, can also be high in nitrates and nitrites. When people eat a lot of fast food and not enough high fiber foods, such as fresh fruits and vegetables, whole grains such as quinoa, barley, roll or steel cut oats, as well as nuts and seeds, their colon cancer risk is significantly increased. Which takes us back to the worrisome increase in colon cancer, particularly among younger people that we have seen in the last few decades. Other risk factors for colon cancer include being overweight, lack of regular physical activity, and consuming alcohol and tobacco. Recently, researchers identified a link between antibiotic use and the risk of developing colon cancer before age 50. This is a major revelation since we start giving people antibiotics as children. This is something that is really important to look at in our healthcare society, in our healthcare approach. Antibiotics can be life-saving and can be important. However, we really need to look seriously at the use of antibiotics and try to limit its use to only when it's absolutely necessary. Lung cancer has a well-known and totally preventable cause, which is smoking cigarettes. A related risk, which is also preventable, although not always in one's own hands, is secondhand smoke. There is also danger from third-hand smoke. So what is third-hand smoke? This is smoke that gets on clothes or furniture, which can then be breathed in by those who are around the person. Third-hand smoke is especially a risk for babies because if someone is a smoker, they may go outside to smoke, but then the smoke can settle on their clothes, or if they're smoking in the house, it can settle on the furniture, in the carpet, and particularly for babies, we often are carrying these babies where they might be on our shoulder, they could be on the floor or on furniture where their face can be right in the furniture, and then they can easily breathe in a lot of the smoke and the debris that can settle from the smoke onto the clothes and furniture. Radon gas is the second leading cause for lung cancer in this country. Radon gas comes from the decay of uranium in the soil. It's odorless, colorless, tasteless, and invisible. Radon can be present in homes and buildings, especially in basements. Do-it-yourself test kits are available from hardware stores or online, and there is also professional testing. If you plan to purchase a house, testing for radon should be part of the process. Other risks include exposure to asbestos and diesel fuel, as well as arsenic in drinking water. I recommend getting a good, high-quality, good quality water filter that can be able to filter out arsenic. So one of the brands that I often recommend is a company called Multi-Pure. There also are reverse osmosis filters that will filter out all of the toxins from the drinking water. However, it is really important that you get a water filter that will remineralize the water, will put minerals back into the water that are taken out from reverse osmosis filters. That is particularly important because people can get very mineral deficient if they're drinking reverse osmosis filtered water where the minerals are not put back in there. Moving on to prostate cancer, where the key is to reducing the risk include foods to avoid and others to enjoy, along with specific herbs, vitamins, and nutrients. Research has shown that men who eat a lot of dairy products or who have a high-fat diet, or both, have a slightly increased risk of getting prostate cancer. Other risk factors include obesity, smoking, chemical exposures such as Agent Orange, and toxic chemicals like the ones that firefighters can confront when dealing with burning buildings. Taking vitamin E as a single alpha tocopherol has also been associated with a higher risk of prostate cancer. So when you look at the label of taking a vitamin E supplement, make sure that you are getting one that has both mixed tocopherols as well as mixed tocotrienols. This is something that's important because if you only take the cheap vitamin E, which most cases are just alpha tocopherol, that is something that potentially can increase risk of prostate cancer. What I'd like you to take away from my talk today is that prevention beats treatment hands down every time when it comes to cancer. We all have the power to change based on good, solid medical and scientific research. I trust our discussion about prevention for cancer and the things that you can do to reduce that risk has been useful for you. You're welcome to talk with me personally about any health concerns that you may have so that you too can be empowered with your health. All of the contact information is on our Facebook page. Please remember to visit our online supplement store, which is on our website at drtaketa-wong.com. Our prices are very competitive and proceeds go to helping children with special needs with their medical treatment. A link is in the post with this video. Mahalo, and I look forward to seeing you in another 2 weeks. Aloha.